Good afternoon. My name is Michael Oakes. I'm the president and founder of NeoGraft. And NeoGraft is a unique technology that we just introduced into the marketplace 5 years ago. And the reason it's so unique is because we provide a solution to patients that they've never had available before. Hair restoration is a very important aspect to many people's lives, both men and women. NeoGraft gives the patients a better solution to the traditional strip method in that they don't have the linear scar. There's no downtime, essentially. They can go back to work the next day. And for patients, especially females, a lot of females change their hairstyles very frequently, NeoGraft allows them to go very, very short or keep their hair long without having a linear scar. And they don't have the pain, downtime, and wound healing aspect that you have with traditional strip method. Today, NeoGraft has 3 different aspects of the case which we cover with our device. First of all, NeoGraft is the only complete harvesting system out there on the market. We actually not only core the individual follicles, but we actually harvest them with vacuum pressure. And this allows the physician to harvest the individual follicles one at a time as they naturally occur without any disruption of the stem cells that reside at the top of the bulb. So the NeoGraft device, once they're contained into the collection canister, we can then sort those individual grafts one at a time by hair counts, whether it's a single hair count or a 5-hair follicle. We do that without very minimal manipulation of the individual grafts, and we then take it and utilize those grafts with our implantation device. Our implantation device is completely unique. This patented handpiece allows us to actually vacuum up the individual follicle one at a time and then implant them using positive pressure. So there's no hand-over-hand implantation technique. It's simply pulling it up with air and driving it down into the individual recipient site with positive pressure. In today's practices, physicians are looking for ways to leverage their time within their practice, and NeoGraft actually offers them the ability to provide a state-of-the-art procedure and to leverage the time in their practice. NeoGraft has partnered with a separate company which provides technicians to come into their practice and assist them with their NeoGraft cases.
We have here a 1.0 punch, which is right there, and it's a 1.0 millimeter punch, and it's attached to what we call, this is the contra angle, the motor. The tubing, once the graft has been disattached from the subcu fat, it's going to, there's constant suction going on with this machine. And so once it's released, it's going to go through the hollow punch, through the hollow headpiece of the contra angle, and get sucked through this tubing and into this chamber, the graft canister. The process of harvesting these grafts involves me looking at the angle of the hair. In most cases, the angle of the hair coming out will give you an idea as to what the angle is underneath the skin. So I'm looking at the angle. Once I think I've got the right angle, I'm going to place the graft on the skin. What I tell our technicians not to do is to first press the pedal and then go dive in kamikaze style. And as soon as that rotating punch hits the skin, it starts to roll away, and you've created a scratch mark. Instead, what you need to do is you need to center the hair to the punch, put a little bit of pressure, and place it on the skin. And when you're ready and you think you've got the right angle and you've got that hair perfectly centered to the punch, then you're going to simultaneously push down on the punch and press on the pedal. Once again, you're going to push down on the punch with authority. Okay. The graft has been cored, and because there's constant suction, this graft is now a little bit elevated, but it's not released because it's still attached to the subcu fat layer underneath. So the next procedure involved in obtaining this graft is that allow the top 1/4 of the graft to remain in the punch, threaded into the punch, and I'm going to lay the graft on the side, and I'm going to do what's called a drag and pull technique. So again, I'm going to try to drag it out. I may need, there's the graft actually right there after I've dragged it out. So I don't know if the camera can see it, but there's one graft. Okay, I'm going to proceed with the harvesting. I've basically completed harvesting this donor site that we designated to be the donor site, and pretty much I've skipped around taking every, say, fourth hair. We've got 332 follicular units. In these units, there's going to be follicular units that contain one hair, two hairs, but he actually had a significant number of three hairs, Maurice did. So that's going to help our cause in an effort to try to populate the crown area and provide them with a little bit more density here. So I'm going to make 10 sites, and then I'm going to place them with the implanter to make sure that the depth is correct. When you place a graft, there should always be like 1.5 millimeters of tissue protruding, kind of a cobblestone look, because as we all know, when wounds heal, they contract, and they'll pull that graft in. And what you don't want is these countersunk grafts creating little divots wherever you placed a graft, and then you've got a little divot with a hair coming out. So we avoid that by leaving the graft just about 1.5 millimeters of tissue protruding. That, within the next 7 to 14 days, will dry and slough off, and you're left with a nice smooth surface and a hair coming out. There it gets sucked in. I'm going to find me a slit, place it next to the slit, drag it over, in effect opening it, and place the graft inside.
Baldness kind of happened to our family. My father was bald. I've got 3 older brothers, and 2 of them were bald at a very early age. My wife was not so much concerned with my hair loss as I was. It affected me more than it affected her. We discussed several of the solutions out there, one of them being a hair transplant. And at the time that I was looking at it, there was only the strip method was available. And I don't know if you've seen the strip method, but it is a very barbaric procedure. They literally take a long strip out of the back of your head, and then they sew it back up again, and you're left with a scar. She was not excited about that. I was not excited about having a long scar in the back of my head. When we found out about NeoGraft through a friend of mine, we researched the procedure, and it just seemed to be much more of a kinder, gentler procedure, if you will. They call it minimally invasive. Now that I've had the procedure done, and it's been about a year ago, I'm glad I did it. I walk around, I catch myself looking in mirrors, and I look younger. Occasionally I'll get a comment when I tell people my age. They can't believe that I'm that old, and it's just a really good feeling to be able to run my fingers through my hair again. The procedure itself was not painful at all. Recovery time was basically, there was none. I went back to work and started doing the things that I do on an everyday basis the very next day. First day that I had the procedure done, I wore a bandage that night. The night after that, I didn't wear one, and everything was basically healed in the donor where they had taken the hair to implant in the front part. Was basically healed. At about 7 days, I had a little bit of scabbing up here, and at 14 days, all the scabs had fallen off. Then after that, it was about 3 months before I noticed that the hairs were actually starting to grow. I call it sprigs. You could feel the sprigs coming back in and growing longer. At about 6 months, it looked very good, and then at about 1 year, it looked absolutely fantastic. Since I've had the procedure done and my hair has grown in, and it's I feel like I've got a large lion mane. I can throw away the baseball caps that I used to wear to kind of cover up the hair loss, and now I can roll down the windows and stick my head out and feel the wind blowing through my hair.
I'm Barry DiBernardo. I'm a plastic surgeon from Montclair, New Jersey. There's one new technology that we're very excited about, and that's called NeoGraft, which is going to revolutionize hair transplantation. I've been doing hair transplant for 20 years, but until now, we have not been able to overcome that scar in the back. And now that we can eliminate it with NeoGraft, patients that were never going to do hair transplant are coming in. They're very excited about this new technique. What it can do that is different from the old techniques, the lack of visible scarring, the faster recovery, the reduction in the post-hair transplant recovery time. I may be a plastic surgeon, a physician, a hair transplant surgeon, but I'm actually a patient also of NeoGraft. First of all, without having that scar in the back, it's a lot more comfortable. There's less swelling, there's less pain, there's less numbness. The small little dots in the back of your head heal within a few days. You don't have that long scar. You don't have the pain from the scar. You don't have the months of numbness that comes from the big incision. So the recovery time is much faster, much easier, and the quality of the grafts going in are superb to create the frontal hairline. We are always in search of the better and the best and the future technologies. I think in this category of hair restoration, we're there today. The NeoGraft has brought us to a point where everything has been maximized to the fullest in terms of recovery, in terms of the look of the transplant, the natural contour of the hairline, that we have been waiting for this ideal. It's here now, and I could recommend to those who have been searching and waiting that the time is now, and it's actually a great time to have your hair transplant because we do have this technique now.